let's talk a little bit about erectile dysfunction, ED. Scary terms, but a lot more common, a lot more prevalent than people realize for a lot of different reasons, right? Why do we care about it so much, right? Because somebody might think, well, it's just erections, it's just sex, who cares? Actually, we've identified a few key factors with this. Number one, the fact that erectile function, sexual health, sexual satisfaction is a big marker for people's overall happiness. Number two, if you have some degree of erectile dysfunction, particularly if it's from vascular reasons, that's what I'm just going to talk about in a couple of minutes, it can actually be a very early risk factor for heart disease. So it's not as benign and it's not as isolated as people realize. It's actually a lot more factors that are associated with it. There are different causes for it, right? So they're not all the same. Clearly, there is an emotional component to it. There is very much a hormonal component to it. There is a neurologic component to it. And what we focus on, what we talk about quite a bit, is a vascular component, right? Meaning that contrary to what people think, the penis is not a bone, it's a muscle, right? It's blood flow, it depends on relaxation of smooth muscle, it depends on the blood vessels, which is why, not surprisingly, there are a lot of different therapies. So the goal is to basically tailor the therapy to the case. So you first have to do a little bit of an evaluation. It's not same thing for everybody, same dosage, same management. There are options, clearly. Viagra, Cialis, and Levitra, basically. That's only to treat a certain component of ED. There are injectable therapies, both with PRP, with stem cells, interesting things coming down the pike, and particularly with some of the therapies that have been around for a little bit longer, components that you may have heard about called BiMix Trimix and Quadmix. So they're essentially combinations of drugs that are designed to enhance blood flow to the penis, enhance smooth muscle relaxation, but also sort of keep those valves tight so that the blood that rushes through actually can stay where it belongs long enough, right? So again, we always focus on hormone health, and clearly a lot of it begins and ends with hormone health. But it's also an issue of circulation. It's also an issue of nerve function. It's also an issue of emotions, right? So the idea, when we talk about optimization, we're talking about optimization across the board. We talk about optimizing the brain. We talk about optimizing muscle function, blood flow. So there are a lot of different mechanisms that go into a healthy, strong, satisfactory erection. For that reason, you have to tailor the treatment to the individual, right? So I preach that on a daily basis. It's very important because that almost guarantees you much better outcomes, right? In the sense that you actually are diagnosing things correctly, no different than any other medical or otherwise condition. You have to first be very clear as to what you're treating and then proceed accordingly.